name is Chase, and this is my lab animal procedures video. First thing I'm going to talk about is rat and mouse nutrition, housing, behavior, those sort of things. They are primarily nocturnal animals. They do prefer to be awake at nighttime, but they can adjust to your schedule. If you handle them a lot during the day, they can flip-flop. They are highly social animals. They usually do very well in pairs, as long as they're not overcrowded. Sometimes intact males can become aggressive, as well as some females with their pups. And handling them a lot helps too with becoming more comfortable. They're very social animals, so if handled regularly, they tend to not have any issues. They prefer environments where they can burrow. Solid bottom cages is preferred, so they don't get their feet stuck in the wires, that sort of thing. And then some sort of soft bedding. And cages with multiple platforms that they can climb up and down and is great. That way they can exercise. But in a lot of lab settings, they usually have shoebox cages or ones that hang down. They are continuous chewers. They need to keep their teeth ground down. So something in there for them to chew on. A lot of times they'll chew on their bowls, bottles, that sort of thing. Pretty much anything that's in the cage, so you want to make sure it's not toxic. House them away from other species. They are prey animals, so don't house them with, other animals that they may be prey to. Keep their cages very clean. Clean it once a day if needed, depending on how big your cage is and how many animals that you have in there. Temperature, they do well around 65 to 75 degrees, and then humidity is between 40 and 60. Make sure to keep water available all times. Depending on the rat and mouse, a lot of them, you can keep food with them at all times and that sort of thing. But some of them can become obese, so you just kind of have to judge that individual animal. A lot of commercial diets are perfectly fine for them, and a lot of pet rats and mice, they get supplemented with fruits and vegetables, whereas in the lab settings they usually do not. But again, limit them because they can become obese. About rat restraint, there's various ways that you can restrain rats, just depending on what you're going to do. Some rats are fairly easy to restrain because they're used to being handled. This guy, however, is not very used to being handled, so restraint is going to be a little trickier with him. One way that rats are restrained is by grabbing the base of their tail. You want to do it as close to the body as you can, and you don't want to hold on to just the tail for very long periods of time. This should just be quick, we're going to move from one cage to another, something like that. But when restraining rats, a lot of times it's a good idea just to have a hold of the base of the tail. You can also scrap them and hold them by the base of the tail. If you're going to do like sub-Q injections, things like that. You can also wrap your hands around them and then flip them over, grab them by the base of the tail if you need to do something on the abdomen. Another way would be taking your fingers and just sliding their head through them. Just be careful not to hold on too tight. You can crush them. They're fairly delicate. And there's also different restraint boxes that you can stick them in, or if you need to do more in-depth procedures, you can use anesthesia as well. I'm going to talk about rat and mouse reproduction and how to determine gender in them. They're both very similar. They have a couple of differences, but not much. They're both spontaneous ovulators. They have about a 4 to 5 day estrus period. When determining gender in these guys, they're both going to be very similar. It can be determined right after birth. With females, you're going to have a larger distance between the papilla and the anus, and then in males, they're going to have a larger papilla. So this little guy right here, this is a male, and our mouse is also a male. A lot of times at pet stores and stuff, when you buy them, they will only sell one gender, but before housing, different rats or mice together that didn't come together, it's always good to check unless you want babies. Their gestation periods is for rats 22 days, and they generally have 6 to 12 pups, and then mice is 19 to 21 days, and they can have 10 to 12 pups. in a litter, and they're usually sexually mature sometime between 50 and 60 days.
Go.
I'm going to give this little guy a sub-Q injection. When doing that, you want to grab right behind the neck where they have a little bit of scruff and just kind of tint it up. Take your needle, very small needle, you don't want to get too large of one. Remove your cap, and once you have your tinted skin up, make sure you have a good grasp on him so he can't wriggle around. And just make sure you have a nice little tint there, and just gently push it in, and then push your medication in and gently pull back out. You can also aspirate to make sure that you don't have any blood, but generally you should be safe in that particular area. When medicating rats orally, there's a couple of different routes that you can use, but for today we're just going to give a little bit of medicine to this rat in the mouth, just using a syringe. So in doing that, having them, for me, for this particular rat that hasn't been handled a whole lot, having him on the table is easier. Just kind of grasp him in your hand, gently scruff, and then when giving the medication, stick it in the corner of the mouth, and he probably will fight it a little bit, and just smoothly squirt it in there, making sure not to do too much at one time, and little bits at a time if you have a lot of medication, but generally with these smaller animals it's not much, and that's it.
Go.
I'm going to draw blood from this rat's tail here. When doing it, you want to use a sterile technique. Generally, shouldn't have to shave the area. Their tails are usually pretty naked. Wet it down with alcohol. Take your needle. You want to use the correct gauge needle. And doing it under anesthesia is usually the best route. Find the little tail vein and poke it right in there. Try not to move around a whole lot. And draw back what you need. And then pull out and hold pressure on the tail. Restraining mice, it's very similar to rats. You want to grab at the very base of their tail. You could hold it for short periods of time, moving them cage to cage or quick movements, that sort of thing. With a mouse that has been handled frequently, it's much easier than this particular mouse has not been handled a lot at all. He's fairly little. So you want to be gentle and not freak them out too much. It makes it harder in the future for restraint. You can do a couple of things. You can scruff between their legs if you need to flip them over like that. Keep a hold on the base of their tail just in case they do escape your grasp. But don't tug on the tail, anything like that. You can hold them for various procedures. They do have boxes that they can be placed in, or using anesthesia is also a good route. I'm going to give him a sub-Q injection, very similar to the rat. You're going to do it back here behind the base of the neck. Tint your skin up so you have a nice space there. Take your syringe out, and you're going to want to gently poke in smoothly. Withdraw. Make sure that you don't have any fluids in there, and then go ahead and put your fluids in and pull out, and you should be good.
Go.
I'm going to give this little guy an IP injection. He's really tiny, so when they're this little, you have to be really careful. Make sure you're injecting in the correct spot. The appropriate spot is going to be in one posterior quadrant of the abdomen along the line of the hind limb. So when giving this injection, you want to find the appropriate spot and go ahead and inject, aspirate back, make sure you don't get any fluid or anything back. And once you're good, go ahead and push your syringe in smoothly and then pull out fairly smooth.
Go.
I'm going to go ahead and give this little guy some oral medications. An easy way to do it is to either scruff them or put your fingers kind of around their head and just hold them still. With your medication, poke in the corner of their mouth. A lot of times they do like to nibble and stuff, so sometimes it's easy to get that syringe in there, and then gently push the medication in, not too quickly. I'm going to discuss basic care needs for the rabbit, as well as housing, feed, those sort of things. With rabbits, cages vary. You can have stainless steel cages, wire cages. Some people let them free roam in their house. A lot of people have hutches outside, those sort of things. When they do have cages, a lot of times they'll have mesh bottoms to help with waste cleanup, Rabbits' waste is very high in ammonia, should be cleaned every day. Some people also have litter boxes and they do have them in their cages or running around their house. Rabbits are very easily litter box trained. With feeders and watering devices, you want to try and hang those so that they don't get dirty or any sort of feces or urine or anything like that in them. It's a lot easier to keep them clean, and those should also be changed every day. Hay or some sort of high fiber roughage should be available to them also at all times. They need that in order to prevent themselves from getting hairballs. Temperature for them should be kept fairly cool, between 62 and 70 degrees. If they are outside, you want to make sure there's a way to keep them cool in hotter weather or warm and cooler weather as well. Humidity should be about 30 to 70%, so pretty wide range there. They are herbivores, so they eat a lot of leaves and plants, veggies, those sort of things. If you're supplementing their diet with veggies, you want to try to keep that to somewhat of a minimum. They do become obese very easily. So a couple times a week is perfectly fine for treats and carrots and stuff like that, but preferably not more than that. Also, another thing to watch is their teeth. They do continuously grow. So some rabbits, their teeth don't line up appropriately, so they will need to be trimmed regularly. Also keep in there things for them to chew on, sticks, those sort of things. They make a lot of things that you sell at the pet store to keep their teeth trimmed down.
Cute.
I'm going to sex this rabbit. A lot of times if you flip them on their back, they kind of go into a trance-like state and will lay there pretty well for you. Females are going to have a slit-like genitalia, and then males are more of a rounded urethral. They'll also have the presence of testicles. This rabbit does have testicles, so he is definitely a male. With their gestation and reproduction, they are induced ovulators, and their gestation period is 29 to 35 days. I'm going to perform a sub-Q injection of some fluids on this rabbit. There's two places that you can do it. You can do it in the scruff, just between the shoulder blades back here, or you can do it in the lateral space, just cranial to the pelvis, and I'll do it in his scruff today since he's sitting here so nicely. You want to make a little, pull the scruff up, make a little tent, and just poke it in there. Make sure you don't go all the way through. Go ahead and aspirate, make sure you don't have any blood, and then just insert what you need and pull straight out. I'm going to draw blood from his marginal ear vein today. You can also draw blood from the jugular cephalic, lateral saphenous, or the central auricular artery. When drawing blood, you want to shave the area that you're going to draw from, so it's more sterile and you get a better visualization of the vein. And wet it down with alcohol. You'll want to use a fairly small needle because their veins are pretty small. Have your restrainer hold off, and insert in the ear, and draw back until you have some blood. And then once you get your blood, go ahead and hold off, and make sure you hold off well on that ear vein so it does not blow up. I'm gonna trim this duck's nails. You wanna make sure you're using the appropriate size clippers for it, and be careful not to cut the quick. This duck's heart and lungs today.
When listening to the heart, you want to listen right around the keel. And then when listening to the lungs, you want to listen on the back between the feathers. Make sure they're nice and clear, there's no cracks